Welcome to Rock Solid, the Round Rock Business Leaders Podcast. Join your host, Bryan Eisenberg, as he explores the journeys of entrepreneurs and companies across Round Rock, Texas. From startups and nonprofits to large organizations, each guest shares their passion for doing business in this thriving community. Let's dive in.
Hi, everybody. It's Bryan Eisenberg, and I'm here with Dr. Mark Malone from Advanced Pain Care. First of all, I want to congratulate you on your anniversary. We're recording this, basically this month is your 23rd anniversary.
That's right, Bryan. Thank you so much. We're so glad to be here, and thank you for having us.
Now, Advanced Pain Care, I mean, there's a lot of pain centers now, but you guys have grown tremendously in this area. I know, in Round Rock is your flagship location.
That's right.
And you have 9 here in the Austin area, but 13 total?
It's roughly 9 in the greater Austin area, but statewide, we have about 20 locations.
20 locations.
Yes, sir.
And I think when a lot of people think about, maybe a pain center, they might think of a small little clinic or something like that.
Yeah.
Could you describe what these pain places look like?
Okay. Well, so I'm happy to say I'm going to brag a little bit. I understand we're the second largest pain clinic in the United States now.
Okay.
So possibly in the world. We have 25 doctors. It's a multi-specialty clinic, which is really the best kind because pain is complex. And you need to understand pain from several different vantage points, including pain management, neurosurgery, rheumatology, orthopedics, pharmacology, and psychology, and physical therapy. So we have all of those in our clinic, and you can see any of those specialists under one roof.
And you also have to do surgery as well.
Yeah, that's correct.
So it's not just a little like doctor's office. It's quite a bit of a.
It's a big operation, and it's very comprehensive. So we're trying to cure as many chronic pain patients as we can.
Which is kind of amazing because I recently heard that there are over 100 million Americans who are in chronic pain. That's bigger than those who have cancer, diabetes, heart disease. It is the number one, problem.
Yeah.
A third of Americans. And it's not something that doctors do well with. And why is that?
Well, there are multiple reasons why it's hard for a family care doctor, for example, to do it. One reason is it's hard as an individual or a family care doctor to prescribe opioids, which is one of the mainstays in chronic pain management because of the opioid crisis and the street problems, the fentanyl coming in over the border and all that stuff. We have to be very careful and go through several steps to prescribe opioids to patients. And individual doctors, primary care doctors, are not equipped to do that.
Yeah, I mean, I was reading an article in the New York Times this past week about pain, and they were saying that the average doctor really doesn't like treating patients in chronic pain. One, because it's really hard to measure.
Yeah. Right.
And two, they find them, no pun intended, a pain.
Yeah. Well, they're high maintenance. They're in a lot of pain, and these people, bless their hearts, they're miserable, and they're at the end of their rope. So many of them are at the end of their rope psychologically, economically, and physically. They're just hanging on by their fingernails.
And I think what makes you special, and I've had the fortune to be at your location and meet there for one of the Round Rock Chamber events, and got to meet several of your evangelists and your community liaisons and some of the doctors. But what really struck me was your personal story, and I find this is one of the big challenges in a lot of healthcare in general, is that the doctors can't relate to the patients.
Right.
But you started after you started having pain.
Yeah, exactly. Well, I have a big story to tell. I actually started my pain clinic before I became a patient myself. But I was practicing pain management for several years when one day it was in 2008, I was lifting something heavy, something too heavy for me to lift, and I felt a pop in my lower back, fell to the ground, and from that moment on, I was a chronic pain patient. And that's a miserable place to be. I could barely get out of bed for a whole year.
Wow.
I lost 40 pounds because I couldn't get to the refrigerator, literally. I mean, I was miserable. And I had to learn how to work from bed, working on a laptop and a cell phone for basically a whole year. And that made a huge difference in the practice. The practice struggled and almost closed, but I was able to keep it open. I had a couple of junior doctors that did all the work,
Mm-hmm.
and some brilliant assistants, medical assistants, and nurses. But we kept it going, and then I was able to gradually come back to work part-time. And then a few years after that, in 2017, the new spinal stimulators came out. And spinal stimulation is the biggest innovation that has happened to pain management in my lifetime, and probably in anybody's lifetime. The stimulator is a device kind of like a pacemaker that actually blocks pain signals in the spine. So chronic pain, the severe life-altering chronic pain that we are talking about, is essentially nerve damage.
Yep.
And those nerves are damaged. I damaged some nerves when I popped a disc in my back. I had surgery. It didn't help the nerve damage. It stabilized the spine, but it didn't help the nerve damage. And I was on, opioids. I was on morphine. I had injections, physical therapy, chiropractic care. Nothing really helped. But I got the stimulator in 2017, and it was like night and day. Turning on a stimulator in my spine blocked all those pain signals. And now, how many years later, 8 years later, it's like it never happened.
Rock Solid is produced and recorded at Round Rock Studio. Located right here in Round Rock, our state-of-the-art studio is built for podcasters and creatives alike. We offer multiple professionally designed podcast sets, top-notch recording gear, and a full photography studio ready for any project. Whether you're launching a new podcast or upgrading your existing one, we can help with multi-camera recording, editing, and everything you need for success. Record with us at Round Rock Studio, your local podcasting partner.
What's fascinating to me, and I understand a little bit about the science behind the stimulators, but more so it's like, there's lots of people like you who could have had the exact same injury, but not ended up in pain. And medical research really doesn't understand where this pain is coming from or why.
It's, that you've hit the nail on the head exactly, Brian. What it is nerve damage. And you can't tell if someone's going to get nerve damage when they pop their back. It could happen, yes or no. It's about a 50-50 proposition. And nerve damage is microscopic. You can't see it. You can't look at, and you can't take those nerves out and look at them under the microscope. That's not possible.
Nothing to test them.
There's nothing to test.
You can't plug in and
you can't. There's no diagnostic port on the human body. So like you have on your BMW, but it's nerve damage. That's what we're talking about. And chronic pain is nerve damage. That's essentially what we're talking about when we say chronic pain.
And beyond the nerve damage, it's, as you mentioned earlier, there's a big psychological component to
huge.
pain. And,
yeah.
I've both my parents, had cancer and were treated for it. And, my dad with the neuropathy and the pains that he had. How do you address, obviously, both the physical and that mental side?
Yeah, great question. Because chronic pain goes hand in hand with depression, anxiety, and other psychological syndromes.
Weight loss
or weight gain in some people. Chronic pain is, your body and your mind are one and the same. So you can't suffer chronic pain without suffering mentally as well. And so that's why we have our behavioral health department, which is staffed by social workers. They're trained in counseling. And we also have a physical therapy department. Those go hand in hand, physical therapy, social work, and pain medicine. Now,
I imagine you see a range of clients, right? Probably from about how young to how old? Like, what does it look like?
Occasionally we see teenagers who have nerve damage from car wrecks or sports injuries.
Okay.
But mostly it's people who are old enough to start suffering from spinal degeneration. And that's like getting gray hair. If you live to be old enough, like 50, you start getting some gray hair. And that's when spinal degeneration starts. The human body perhaps was not designed to last much more than 50 years. And so about that time is when the spine, the discs that separate the bones in the spine start to flatten out and degenerate and fall apart. And that's when the bones in the spine start to come together and grind and pinch the nerves that run between those bones. And that's where chronic pain is, that's where nerve damage is, and that's where most of our patients are.
So if a friend of mine called you tomorrow, they called one of the offices, they've been in pain, they were in a car accident several years ago, and, they've just been trying a little bit of everything. What does it look like when they call you? What is that 90-day process of kind of figuring out where
Yeah.
they're at?
Well, we pride ourselves on being able to say same or next day appointments
Okay.
available. So because we know it's an acute issue, we know that these people are miserable, and it's either us or go to the emergency room, or both. Sometimes they go to the emergency room and then get referred to us because it's their misery. Just like when I popped my back, I had to have some pain medicine. I couldn't get off the floor for about 3 hours. It's a real emergency. And we know that. So we try to get them in on the same day or the next day when they call. And usually we can.
Okay.
So that's the start. They see a pain specialist on the first day, a doctor who's double board certified in pain management and anesthesiology. And that doctor gives them a thorough history and physical examination. We do x-rays. We may order MRIs. We may order blood testing or other studies. And then we make a comprehensive plan of treatment. We'll often prescribe medicine. Sometimes it's pain medicine. Sometimes it's a muscle relaxer or an antidepressant, for example, depending on what the patient needs. And then we'll get that plan started. We'll see them back in a week or two. Often we prescribe if it's a damaged nerve in the spine, we'll often start with a spinal injection where we put medication on that damaged nerve under x-ray guidance and under anesthesia so that we can relieve the pain and inflammation.
Right, and I believe I've seen you do that like on the video on your website.
Yeah.
Right, is that what that is when you're going in there with like those little micro needles?
Yeah, right. Yeah, that's a lot of what we do.
Awesome. Now you've been in the Central Texas area for a very long time. What drew you to this area, and why do you think it's such a great place for you to have had the success that you've had?
Well, initially, I grew up in Waco and, loved it. It's a great place to grow up. It's a good place to have a family. I moved down to Austin to go to UT, which, I was attracted to University of Texas. I was attracted to the hill country, the beautiful lakes and rivers. Fell in love with it even more so. Then I had to leave to go to Dallas, then Houston for medical training. I came back in 91, basically as soon as I could get back, and opened. I was a hospital anesthesiologist for my first 11 years here in Austin. And then I knew some people in the pain management business, and modern pain management, it's really started in 1989 when the technology to do spinal injections came about, when the C-arm, which was invented to do orthopedic surgery, began to be used by some pioneer radiologists and anesthesiologists in San Antonio to do spinal injections. And that's when modern pain management was born. I trained with some of those people back in Houston and back in 1998, and then came back to Austin and opened a pain clinic.
Wow. What is it about the Austin area that you enjoy? Because obviously, people seem to love what you're offering, but what is it that you love about there?
Well, I love the University of Texas, and I love the hill country, and I love the music scene and the art scene and the entrepreneur scene. It's a very exciting place to be. It's really unique. And we developed a Round Rock presence back in 2007, just before the back injury. I bought a building up here. I had plans to build a surgery center and a big clinic, comprehensive clinic, multi-specialty, and eventually was able to do that. But I was attracted to Round Rock because it was untapped. Not that many specialists back then. Really, a lot of people needed our services, and the infrastructure it's great. It's because it's not as entrenched as Travis County, but here in Round Rock we have for example, a great fire department, a great police department. Yeah. The city council is responsive. If we need a permit for something, we get it right away. So it's a great place to do business.
Yeah, I've seen that, and you guys are also phenomenal as a team, being out there and supporting the community. For example, we met at an open house at your place for the Round Rock Chamber. Yeah. Why do you feel that that's such an important part of your business? I mean, obviously, there's a great need for your business, but you also give so much. And why
Oh,
is
yeah.
that?
Well, we like to make connections to the community. We like to know as many people as we can. We have our favorite charities. We support a lot of veterans organizations. For example, we support Little League. We support chamber events. We support churches. So, we love to be part of the community.
Now, one of the things that you mentioned earlier is obviously you're an anesthesiologist,
Yeah.
and from that perspective, pain is a subset of anesthesiology.
Yeah.
Do you think more doctors should focus in on the training side to have more responsibility for learning about pain, or would you rather just keep it to yourself and just let them give you all the room to open up all these clinics?
No, there's always been a shortage of all kinds of doctors. There's a huge shortage of pain doctors. There's a huge shortage of anesthesiologists. The training is intense and it's comprehensive. So the infrastructure today only supports training so many doctors. So I'm really, Michael Dell just opened up a new medical school in Austin, Dell Medical School with the University of Texas. That's a great step forward. We need to do that about 100 more times. We need 100 more medical schools, and I'd love to see that.
That would be that would be quite a thing. If you could imagine where pain resolution would be, right, and pain treatment would be in the next 20 years. Because from what I'm understanding is that pain research is probably 20 years behind cancer research, behind everything else, because there really hasn't been investment.
Yeah.
But if people started focusing in on some of that investment, especially since it is the number one most chronic condition, what do you think that would look like in 20 years from now?
The sky's the limit. There could be some great breakthroughs. This spinal stimulator is the greatest breakthrough so far, and it's getting refined and improved every year. And so we're treating, hundreds. We do hundreds of these every month, and essentially a cure for many of these patients, which is great. But it costs a lot of money. It involves surgery. Someday there may be a drug that can treat nerve damage.
That would be pretty amazing. It would be a lot easier than having to go through a whole surgery.
Oh, sure.
Now, for people who are interested in understanding more about your process, I also know that obviously you work with all kinds of insurance.
Oh, yeah, all kinds.
Everything from Medicaid, the VA. I've met a couple of your ambassadors who are former veterans as well.
Yeah.
Private insurance.
Sure.
What's the biggest obstacle for people, learning about advanced pain care and getting in there?
Oh, well, the biggest obstacle is just, getting the word out, because it's such a recent advent, the modern care for pain, advanced pain care, as we named our business, is so recent. It's only been around for a couple of decades at the most. So a lot of the doctors that trained more than 20 years ago never heard of treating pain really like we do here. Just giving some hydrocodone or oxycodone is about as far as it goes in 20 years ago. But today we have so much more. We have all kinds of treatments that it begins with pain medicine, but it ends with resolution of nerve damage.
So, there's a lot of people and a lot of storefronts popping up that offer pain care.
Sure.
How does someone as a consumer know which is one that is really going to offer potential solutions and one that's not just about?
Well, that's a huge topic. You could write books on it, Brian. And there's a lot of different practitioners that treat pain. Everyone from chiropractors to, dentists treat pain, and they're very successful at it. Love my dentist. But the type of pain that we treat is not the, 1/3 of all Americans have chronic pain. Well, that's not the debilitating, can't get out of bed pain that we're talking about. I'd say about 1% of Americans have that much pain where you can't get out of bed, you can't go to work, can't take care of yourself or your family. That's equal to cancer in my mind, because it leads to an early death, depression, suicide, all of that, divorce, loss of job, and all of that stuff. That 1% is who we really focus on. And we're spending a lot of money, and this podcast is just one example. We're trying to get the word out to as many people as we can that if you have or know someone who has that kind of pain, we're where you need to go, because it's not going to respond to physical therapy or chiropractic care or even just pain medicine. You need comprehensive care that only a center like ours can deliver.
So that would probably be one of the first things that they should look for. In other words, if they're going to any kind of pain center, whoever it is, whether it's you or a competitor, you want to know that it's a multidisciplinary approach.
Multidisciplinary with board-certified specialists, including pain management, anesthesiology, and neurosurgery.
Okay, now we get to the fun part of this. What's some of your favorite hidden gems in the area? Because obviously you get around because you've got a lot of clinics that you have to go visit to. What are some of your favorite spots in the area that people need to go check out?
Oh, well, especially in Round Rock. I mentioned the infrastructure is what we live for and love here because, we can rely on the fire department and the police department. But in terms of just enjoying Round Rock, we love Round Rock Donuts. We love Old Settlers Park. We have events out there. We have a kickball tournament every year in the park, and we love that. And some of the restaurants, Flicks Brewery and movie houses right across the street from us. And, we love all those places.
It's a lot of old favorites.
Yeah.
Do you have a secret one that you don't really tell people about that's like if you had to plan a dinner?
Plan a dinner. Oh, man, let's see. What are some of those? Stacy, help me out here. What are the? There's a little Mexican restaurant right down the street called Guadalajara.
Okay.
And we love to eat lunch there.
Awesome.
So that's a little secret.
Now, if anybody wants to get in touch with Advanced Pain Care or connect with you on social media, where's the best place for them to find ways to contact you?
Just go to the internet and type in Advanced Pain Care. We'll come right up. The website itself is austinpaindoctor.com, but you don't even need to know that. Just Advanced Pain Care comes right up.
Awesome. Thank you so much for your time today.
Great. Thank you for having us, Brian. Appreciate it.